Minister, my question is in regards to the severe shortage of public health nurses in the Dublin Midwest area. I don't think this is just an isolated situation. I think this is actually across a lot of CHOs in terms of public health nurses. So I'd like to get your thoughts in relation to the shortage, particularly in Dublin Midwest.
Deputy, can I thank you, and also Deputy Collins. I think we're taking the two together, are we, Laskin Curla?
Yeah, you've made that.
Can I thank Deputies Kenny and Collins for raising this, and on the back of their questions I did engage with my officials and the HSE on this, and as per your question, they are accepting that there are shortages in the child development checks in Dublin South and in Dublin West. This is not something that is acceptable. The public health nurse service in Dublin South and West, it is experiencing significant shortages in terms of public health nursing, and they have said that recruitment is particularly challenging. The HSE has advised that the local service is working to ensure that those with the greatest need in the community are prioritised, and that site-specific contingency plans continue to be refined monthly. I want to fully recognise the frustration and the worry for these parents who are struggling to access the routine checks. I want to emphasise that if any parent has an active concern about their child, they should contact their GP or their local health office. We want to ensure the delivery of a full range of services provided by the public health nurses. We are progressing several initiatives at a national level, both within my department and in the HSE, to address the challenges in terms of recruitment. There is an embargo in place which we're aware of. It is having an effect. This is one of the areas it is having an effect. Before the embargo, there were challenges in terms of public health nurse recruitment into these teams, and it is something that the HSE is looking at to see what additional supports can be put in place. One of the advantages we have of moving to the regions this year is that the regions will be able to deploy and redeploy healthcare professionals on a priority basis. And essentially, as I see it here, what's happening is the inverse care law, which is the communities and the families that need the additional public health supports the most are actually getting it the least. So it's not something that we're satisfied with at all, and I am engaged with my department and with the HSE to increase the amount of public health nursing services that are available, because I fully accept it is a real worry for parents.
Gino Kenny.
Sir, this has been going on for a number of years, and there's parts of Lucan, North Clondalkin and Newcastle where there is parents with newborns and infants that literally have no checks in terms of their children, and that can only be a bad thing. And I was looking at the trend in the last 5 years in relation to public health nurses. There's been a steady decline of retaining public health nurses, and that is very, very worrying, because, as you know, a child needs at least 3 to 4 developmental checks throughout their first 4 years, and if they're not getting them, things will be missed, and that is extremely worrying in terms of newborns and infants. So this has to be acknowledged, and it has to be rectified, because otherwise certain things, particularly around children, will go unnoticed, and that's only really a detrimental effect for the child and the parents.
Deputy Collins and Deputy Kenny, look, this is a serious issue. I fully accept your representations, and Deputy Collins, I take your points absolutely. We can't have children not getting these developmental checks, and we can't have parents who are worried, and we certainly can't have the kind of delays that you're referencing. So I'll commit to you now that I'll take this up at a senior level within the HSE this week, and we'll see what measures can be put in place, because if there is a certain area, which there is, which is significantly understaffed, we need to look at deployment from other areas. It simply was not enough to say, well, for that community there, then they're just going to have to deal with the delays, where these other communities are fully staffed and are getting what they need. So look, what I'll do is commit to you to raising this directly with the HSE and asking for a rapid temporary solution, which I imagine would involve some deployment from other areas, and then we will look to see what can be done to accelerate the hiring, or indeed, as Deputy Collins said, the maternity cover as well, because the situation, I'm certainly not going to stand here and say that the status quo is sustainable. It certainly is not.